Hello, my name's Dr. Alan Kerry. I'd like to welcome you to another podcast from the South Essex GP training website. With me I have Dr. Sunil Gupta, and we're going to discuss the General Medical Council guidelines on good medical practice, which were produced in 2006. This podcast doesn't give you the full guidelines, so we advise you to go to the GMC website at www.gmc-uk.org for further information. So Sunil, what are the duties of a doctor who is registered with the General Medical Council?
The General Medical Council reminds us that patients must be able to trust doctors with their lives and health. To justify that trust, you must show respect for human life, and you must 1. Make the concern of your patient your first concern. 2. Protect and promote the health of patients and the public. 3. Provide a good standard of practice and care, so that involves keeping your professional knowledge and skills up to date. Recognise and work within the limits of your competence. Work with colleagues in the ways that best serve patients' interest. 4. Treat patients as individuals and respect their dignity, and that involves treat patients politely and considerately, respect patients' right to confidentiality. 5. Work in partnership with patients, and that involves listen to patients and respond to their concerns and preferences. Give patients the information they want or need in a way that they can understand. Respect patients' right to reach decisions with you about their treatment and care, and support patients in caring for themselves to improve and maintain their health. And 6. Be honest and open and act with integrity, so that involves act without delay if you have good reason to believe that you or a colleague may be putting patients at risk. Never discriminate unfairly against patients or colleagues, and never abuse your patient's trust in you or the public's trust in the profession. And the GMC reminds us that we are personally accountable for our professional practice and must always be prepared to justify our decisions and actions.
So what does the GMC say that good clinical care must include?
It says it must include 3 things. 1. Adequately assessing the patient's conditions, taking account of the history, including the symptoms and psychological and social factors, the patient's views, and where necessary examining the patient. 2. Providing or arranging advice, investigations or treatment where necessary. And 3. Referring a patient to another practitioner where this is in the patient's best interests.
What do these guidelines say we must do when providing care?
In providing care, we must do a number of things. A. Recognise and work within the limits of our competence. B. Prescribe drugs or treatment, including repeat prescriptions, only when we have adequate knowledge of the patient's health and are satisfied that the drugs or treatments serve the patient's needs. C. Provide effective treatments based on the best available evidence. D. Take steps to alleviate pain and distress, whether or not a cure may be possible. E. Respect the patient's right to seek a second opinion. F. Keep clear, accurate and legible records, reporting the relevant clinical findings, the decisions made, the information given to patients, and any drugs prescribed or other investigation or treatment. G. Make records at the same time as the events you are recording, or as soon as possibly afterwards. H. Be readily accessible when you are on duty. I. Consult and take advice from colleagues where appropriate. And J. Make good use of the resources available to you.
In the area of maintaining and improving performance, what have we got to do?
We have to A. Maintain a folder of information and evidence drawn from our medical practice. B. Reflect regularly on our standards of medical practice in accordance with GMC guidance on licensing and revalidation. C. Take part in regular and systematic audit. D. Take part in systems of quality assurance and quality improvement. E. Respond constructively to the outcome of audit, appraisals and performance reviews, undertaking further training where necessary. F. Help to resolve uncertainties about the effects of treatment. G. Contribute to confidential inquiries and adverse event recognition and reporting to help reduce risk to patients. H. Report suspected adverse drug reactions in accordance with the relevant reporting scheme. And I. Cooperate with legitimate requests for information from organisations monitoring public health. When doing so, you must follow the guidance with confidentiality, protecting and providing information.
And what must we do to fulfil our role in the doctor-patient partnership?
The GMC mentions 6 areas. A. Be polite, considerate and honest. B. Treat patients with dignity. C. Treat each patient as an individual. D. Respect patients' privacy and the right to confidentiality. E. Support patients in caring for themselves to improve and maintain their health. And F. Encourage patients who have knowledge about their condition to use this when they are making decisions about their care.
What does good medical practice say we must do in order to communicate effectively?
Good medical practice says we should listen to patients, ask for and respect their views about their health, and respond to their concerns and preferences. We should share with patients in a way that they can understand the information they want or need to know about their condition, its likely progression, and the treatment options available to them, including associated risks and uncertainties. We should respond to patients' questions and keep them informed about the progress of their care, and we should make sure that patients are informed about how information is shared within teams and among those who will be providing their care.
When we're working in a team, what must we do?
We must respect the skills and contribution of our colleagues. We must communicate effectively with colleagues within and outside the team. We must make sure that our patients and colleagues understand our role and responsibilities in the team and who is responsible for each aspect of patient care. We must participate in regular reviews and audits of the standard and performance of the team, taking steps to remedy any deficiencies. And we must support colleagues who have problems with their performance, conduct or health.
And in the area of being honest and trustworthy, what does the GMC have to say?
The GMC says probity means being honest and trustworthy and acting with integrity. This is at the heart of medical professionalism. We must make sure that our conduct at all times justifies our patients' trust in us and the public's trust in the profession. We must inform the GMC without delay if anywhere in the world we have accepted a caution, been charged with or found guilty of a criminal offence, or if another professional body has made a finding against our registration as a result of fitness to practice procedures.
Thank you, and thank you for listening to this podcast. Sunil and I would like to remind you again to look at the GMC website for further information. We hope you listen to some of the other podcasts on this South Essex GP training website.